Hello, welcome to the Joslin Asian Clinic webinar series, Diabetes Self-Care for Asian Americans during the COVID-19 pandemic. This presentation is on diabetes management through nutrition and self-care tips. I'm Karen Lau, a registered dietitian and a certified diabetes care and education specialist at Joslin's Asian Clinic and Pregnancy Clinic. For the next 15 minutes, I'm going to share with you some healthy eating tips that you can try at home to help you and your family to stay strong and healthy. Since the beginning of the pandemic, there are more than 8 million confirmed cases in the United States. Over 220,000 people unfortunately have died. Looking at the racial and ethnic breakdown, about 3% of the confirmed cases and nearly 5% of the deaths were of Asian descent. Here are some of the symptoms of COVID-19. You may have coughing, shortness of breath, or having difficulty to breathe. Having fever, chills, or body aches are also some common symptoms. Some may have gastrointestinal symptoms such as vomiting and diarrhea. Some have reported having loss of taste or smell as well. These symptoms range from mild to severe and appear between 2 to 14 days after exposure to the virus. If you encountered anyone who were diagnosed with COVID-19 over the past 2 weeks, keep an eye on these symptoms. If you have any of these symptoms, call your healthcare provider and find out what your next step should be. Some people think that COVID-19 only affects those who are older. This is not the case. Over 70% of these cases are amongst those who are 18 to 64 years old. So it is not only affecting those who are older. It is true, though, those who are older have a high risk of dying from COVID-19. 1 out of 5 people who was between 65 and 74 years old and had COVID-19 unfortunately died. The risk increased to 1 in 3 amongst those who were older than 85 years old. Other than age as a risk factor for increased severity of COVID-19 cases, here is a list of conditions that have shown an increased risk. Obesity or severe obesity is one of the factors. For Asians, if your BMI or body mass index is over 27, it is considered as obesity. This BMI is lower than the BMI for other ethnic or racial groups. Type 2 diabetes is another risk factor. Among all these conditions, there's one factor that you can change today: smoking. If you're smoking, this is a good time for you to change this habit. Here are factors that might increase the risk of a more severe case of COVID-19. Overweight is one of them. This is defined as BMI between 23 and 27 for Asians. Once again, this BMI is lower than the BMI for other racial or ethnic groups. Another factor is type 1 diabetes. It might sound scary that diabetes brings a worse outcome if you get COVID-19, but here is the good news. Well-managed diabetes increases your rate of survival. Here shows a study from China. You can see that those who have well-managed diabetes have nearly 100% survival rate. Similar results are repeated in other countries, including the United States. Here we can see that there's a 4 times difference in the risk of dying from COVID-19 between those who had well-managed diabetes and those who did not. So what is considered as well-managed diabetes? There are 3 measurements that we can use to tell. The first one is the fasting blood glucose. This is the finger stick reading that you can do at home in the morning, after you wake up and before you eat. Another one is the glucose reading about 1 to 2 hours after you have a meal. You can also do this at home. And the third one is A1C. A1C represents your management of diabetes over the past 3 months. This reading is usually done at doctor's office. So what numbers shall we be looking for? In general, for fasting, we would like it to be under 130. After a meal, we would like it to be under 180. And for A1C, we would like it to be under 7%. These are only some general goals. Your goals may be different, so ask your doctor to find out what numbers you should be aiming for. We have heard about the goals, and how are we going to achieve these goals? Here are a few things that you can do. Take all the medications that your provider has prescribed for you and monitor and check your blood glucose at home regularly. Eat healthy, stay active, sleep for 7 to 8 hours each night, stay positive, and maintain a healthy body weight. Today, we're going to focus on the healthy eating part. When you eat healthy, it helps to boost your immune system to fight viruses and disease. It also helps to prevent weight gain, which is important as we know that excess body weight increases the severity of COVID-19. Eating a well-balanced meal will also help you to prevent some of the highs and lows in your blood glucose, and also help you to manage your diabetes better. Here's how to eat healthy. Let's start by imagining there's a plate in front of you. What does this plate look like? How much food are you going to put on this plate? What food are you going to put on this plate? Does your plate look like this? Ideally, you would like to have half of the plate to be non-starchy or fibrous vegetables, such as broccoli, spinach, tomatoes, or carrots. A quarter of the plate should be grains or grain products, such as rice, pasta, noodles, or bread. Or it can be some starchy vegetables, such as sweet potatoes, pumpkin, or corns. In other words, this quarter of the plate should be carbohydrates or carb food. And the remaining quarter of the plate should be protein food, such as fish, seafood, chicken, or eggs. If you don't use a plate to eat, you can use a hand method. Now raise up one of your hands and make it into a fist. Each meal you should have 2 fists of non-starchy vegetables. 1 fist of carb food. Again, they are like the rice, pasta, noodles, bread, or the starchy vegetables such as pumpkin, corn, or sweet potatoes. Now extend your fist and look at your palm. This should be the amount of protein that you have for a meal. We've talked about the amount. Let's now look at the types of food. Let's start from vegetables. For vegetables, we should aim for a rainbow of color. How many different colors of vegetables could you think of? We have red, orange, yellow, purple, white, black, and of course, green. Some examples are tomatoes and red bell peppers for the red color, carrots, orange bell peppers, yellow bell peppers for the orange and yellow colors. For purple color, we have eggplant, purple onions, or red cabbage, and mushrooms fall into the white or the black color. And finally, for green, most of the leafy vegetables, such as spinach, falls into this category. As for protein, seafood such as fish and shrimp are some good choices. You may also want to try having some fatty fish, such as salmon or tuna. They have healthy fish oil in them, which may help to boost your immunity. If you choose to have chicken, beef, or pork, make sure to remove any fats that you can see. Tofu is another very healthy type of protein, and beans also have proteins. You can incorporate these into your meals. Now for carbs, choose whole grains or grains that are less processed. For example, brown rice or multigrain rice. For breads, you can choose those that are made from whole wheat flour. Oatmeal is another very good choice. And once again, beans. Not only do beans have proteins, they're also very high in carb. So this is very good for you to put on your plate. How about fruits? We haven't seen fruits on this diagram yet. You can have 2 fruits each day. Citrus fruits and berries are some good choices. Try to incorporate a variety of fruits so that it can give you a rainbow of color, just like vegetables. You may ask, how much fruits can we have each day then? Let's use your fist once again. Each day, you can have about 2 fists of fruits. Spread them out throughout the day and enjoy the fruits in several sittings. COVID-19 may change your grocery shopping routine. You may want to buy more at one time and avoid going out several times to buy your groceries. Here are some tips that you might find helpful. For produce, you can try having frozen vegetables or fruits. They last longer and they're also very healthy. They might be even more nutritious than the fresh produce that you may buy. For frozen vegetables and fruits, they're typically harvested at their prime and then being frozen, and so most of the nutrients are being kept. For fish, you can try having canned or frozen fish. If you're choosing canned fish, choose the ones that are water-based and with lower salt or sodium. You can also rinse them underwater before you use them. This can help to lower some of the salt contents. For eggs, you can try using egg substitute. They come in cartons and they can stay in the fridge for a long time. If you or your family members drink milk, try using shelf-stable cartons of milk or milk powder as they last longer. We talked about having beans and tofu as part of your healthy meals. These foods actually last for a long time as well. For beans, whether they are dried beans or canned beans, they are shelf-stable and they don't cost as much. And for tofu, they can keep in the fridge for a relatively long time until the expiration date. If you do prefer fresh produce, here are some of the produce that stays fresh for a longer time, especially if you keep them in the fridge. Look at all those colorful vegetables and fruits. You can see that you can choose fresh produce that can last for a longer time and can still keep the rainbow of colors. As for food safety, if you buy your protein in bulk, make sure they're refrigerated at the right temperature, which means at 40 degrees Fahrenheit or 4 degrees Celsius, or in the freezer for 0 degrees Fahrenheit or -18 degrees Celsius. For raw fish, seafood, and chicken, typically they can be kept in the fridge for 1 to 2 days. For raw beef or pork, 3 to 5 days. And for cooked meat or soups, they can be kept in the fridge for 3 to 4 days. If you don't think you can finish them within this time frame, then freeze them as soon as you bring them home. Make sure to thaw them safely before you eat. The best way to thaw these foods is to keep them in the fridge and to let them thaw that way. If you're interested to learn more about staying healthy during this time, check out our websites. We have more resources on COVID-19 related materials, we have recipes, and we talked about BMI earlier. And on our website, there's a calculator for you to find out what BMI you have. And finally, just a summary, make sure you have a variety of food and try using the plate method or hand method and include different colors and different types of food to help you to stay healthy.